Welcome to this deep dive. We take interesting sources and, well, pull out the key insights.
Yep, get right to the heart of it.
So today we're looking at something from healthcare leadership specifically, interview questions for hiring an assistant director of nursing, an ADON.
Right. And our source is a piece from Better Team by Paul Peters. It lays out some pretty typical questions.
And the ADON role itself is pretty significant, isn't it? They're assisting the director of nursing, overseeing staff, patient care, making rounds.
Oh, absolutely. Monitoring activities, ensuring compliance. It's a crucial support role, bridging management, and frontline care.
So our goal here is to figure out what these interview questions really tell us about the priorities in nursing management. Useful stuff, whether you're in the field or just curious about leadership.
Exactly. These questions are like windows into what qualities they absolutely need for someone in that kind of demanding position.
Okay, let's jump in. First question mentioned is, what things do you look for when conducting patient rounds? Seems pretty straightforward.
Well, yes and no. On the surface, sure. But what they're really digging for here is clinical experience depth.
Ah, okay.
Yeah, it's about assessing their observational skills.
Mm.
Can they spot subtle signs? Are they proactive? It's not just checking off tasks. It's about, anticipating needs, seeing the quality of care.
Got it. So it's that experienced clinical eye they're looking for. Makes
Yeah.
sense.
Precisely.
All right, next up. What do you do to handle the stress of the job? This hits on a big reality in healthcare.
Definitely. It's a high-pressure environment. This question isn't just, do you get stressed? It's, how resilient are you?
Uh-huh.
They want to know about coping mechanisms. Can you stay effective under pressure? And crucially, can you compartmentalize? Can you leave work stress at work to avoid burnout? That's key.
Yeah, compartmentalization must be vital. Okay, then there's the interpersonal angle. How would you handle a conflict with staff or patients?
Now, this one is really telling. A leadership role always involves conflict.
Yeah.
Right. The insight here is whether the candidate recognizes that you need different strategies. Dealing with a staff issue isn't the same as dealing with a patient's complaint.
Right, different dynamics, different stakes almost.
Exactly. If they give a sort of one-size-fits-all answer, that's probably a red flag for the interviewer.
Yeah,
They need to show nuance.
needs that tailored approach. Okay, question 4 flips it around. What traits would you look for when hiring new nursing staff?
Yeah, this shows their understanding from the other side. What do they value?
So it reveals their management philosophy, kind of.
In a way, yes. It shows what they think makes a good nurse and a strong team. Are they looking for just skills or also attitude, teamwork, empathy? It reflects their grasp of both the profession and management needs.
Interesting. Okay, and the last one they highlight seems, well, potentially tricky. What would you do if you disagreed with the director about a patient's care?
Ah, yes. This tests quite a few things at once.
Like,
Well, problem-solving skills, for
Right.
one, but also their knowledge of procedure, of policy. How do you navigate that professional disagreement?
within the hierarchy, yeah.
Exactly. Can they advocate for their clinical judgment about the patient, but do it professionally, following the proper channels, respecting the structure, but still making their case? It's about constructive disagreement.
So pulling it all together, these questions paint a picture that goes way beyond just knowing nursing procedures.
Absolutely. You need that strong clinical base, no question. Equally focused on stress resilience,
Right.
really good communication,
Yeah.
and interpersonal skills, especially for conflict. Sound judgment when it comes to building their own team.
And knowing how to handle professional disagreements appropriately, following
Yep.
policy.
Precisely. It's a multifaceted role requiring a blend of clinical expertise and strong leadership qualities.
It really gives you a clearer sense of the demands. It's that constant balance, isn't it? Patient focus on one hand, effective team management on the other.
That's it, exactly. Understanding these hiring priorities gives you real insight into the complexities of healthcare leadership.
It certainly does. And, it makes you think. These core things, expertise, handling pressure, communication, navigating tricky situations, how universal are those principles for leadership in any high-stakes field? Something to mull over.
A very good point.
Yeah?
Definitely food for thought.
Well, this has been really illuminating. Thanks for breaking that down.